Because most cardiac arrests happen at home or in a public place and not at work, you may not have access to a barrier device during CPR. This means that you may need to give mouth-to-mouth breaths without a pocket mask or bag mask device. Although we won't practice this, it may be a skill you'll need to use one day. This section shows how to give mouth-to-mouth breaths when a barrier device isn't available.
Mouth-to-mouth breathing is a quick and effective way to provide oxygen to a victim. Each breath you take contains about 21% oxygen. When you provide a rescue breath, that breath contains about 17% oxygen. This is why rescue breaths are effective in providing oxygen.
Let's go through the steps to deliver mouth-to-mouth breaths. Start by holding the person's airway open with a head tilt chin lift. With your hand on the forehead, use your thumb and index finger to pinch the nose closed.
Now, take a regular breath and seal your lips around the person's mouth, creating an airtight seal. Give one breath, blowing for about 1 second. Watch for the chest to rise as you give the breath. If the chest doesn't rise, repeat the head tilt chin lift. Give a second breath, blowing for 1 second while watching for the chest to rise. If you can't ventilate the person after 2 attempts, check for an airway obstruction, but then promptly return to chest compressions. Make sure you give each breath over 1 second and deliver air just until you make the person's chest rise.